This slide introduces an analytical framework that links individual factors, social context, environmental cues, and cognitive processes to core behavior change mechanisms, illustrated in the center ring. The diagram shows how these interacting elements drive sustained health outcomes, setting the stage for understanding why multi-factor interventions are needed to influence real-world health decisions. Here we summarize evidence that theory-based health programs consistently outperform atheoretical approaches across diet, physical activity, screening, and sexual health, as shown in the left chart. The right panel highlights the underlying mechanisms are still underexplored, and contextual matching matters. So integrating precise theoretical constructs with audience context is the key next step for greater impact. The health belief model frames preventive action as a balance between perceived threat and perceived net benefits, with self-efficacy and external cues shaping whether people act. Practically, messages should raise awareness of susceptibility and severity, while lowering perceived costs by amplifying benefits, reducing barriers, boosting confidence, and leveraging timely cues to prompt action. This slide compares early TB screening campaigns to modern vaccine outreach, showing how cues and barriers have evolved. In the 1,950 seconds, clinicians and posters prompted screening despite stigma and access issues, whereas today, peer stories, social alerts, and digital reminders can counter misinformation and perceived side effects, illustrating HBM's continued relevance for asymptomatic health threats. The Transtheoretical Model breaks change into 6 sequential stages from pre-contemplation to termination, which allows interventions to be matched to readiness. Early stages emphasize consciousness raising and self-reflection, while preparation and action require concrete supports, and maintenance focuses on relapse prevention and commitment strategies to optimize resource allocation and long-term adoption. This slide reviews critiques of TTM limited prediction of stage transitions and overlap between stages, then proposes hybrid models that integrate psychosocial constructs like self-efficacy and social support. The integrated approach aims to improve transitional prediction, tailor interventions more precisely, and produce better sustained outcomes than TTM alone across diverse behaviors. Social cognitive theory emphasizes dynamic interactions among personal factors, behavior, and environment, with observational learning and reinforcement shaping change. The model highlights self-control and self-efficacy as central levers, making SCT especially useful for skill building and confidence-focused interventions, such as training, workshops, and peer modeling, to support complex behavior adoption. This slide outlines 4 practical mechanisms to boost self-efficacy: setting incremental goals, providing mastery experiences, modeling successful peers, and offering verbal encouragement. Together, these strategies raise perceived competence, and meta-analyses link higher self-efficacy to better outcomes like increased physical activity, improved medication adherence, and greater success in smoking cessation. The Social Ecological Model maps multiple influence layers from individual knowledge and skills through interpersonal networks, organizational settings, community resources, and policy. The core insight is that effective interventions must address systemic constraints by building supportive environments across levels, not just targeting personal behavior, to foster lasting health improvements. Here we show how 21st century technology can activate cues to action by integrating HBM, TTM, and SCT into an adaptive intervention framework. Mobile prompts, wearable feedback, and AI-tailored messages deliver timely, personalized support aligned with an individual's stage and context, enabling just-in-time adjustments that sustain engagement and promote real-time behavior change. This strategic application slide matches models to behavior types, readiness, and resource implications. HBM fits one-time preventive actions, TTM suits staged long-term adoption, SCT targets skill acquisition, and ecological approaches address structural constraints. The table guides selection of communication, stage-matched supports, skill-building or policy-level strategies based on audience needs and resources. The final slide presents an integrated multi-level strategy that combines HBM's threat perception, TTM's staging, and SCT's self-efficacy within an ecological framework of social and policy enablers. The goal is layered: adaptive interventions that address multiple determinants, support sustainable behavior maintenance, and tailor design to context and stage for lasting public health impact.